Evening. Welcome to this online webinar of the Online Master in Nutritional Epidemiology and Public Health. My name is Rosalie and I'm one of the study advisors involved in our online master program. And today I will moderate this session. I'm not here alone, luckily. I have here Amanda with me and also Leanne. And we all will give you an overview of our online master and try to answer all of your questions. But first I would like to ask Amanda to introduce yourself, please.
Thank you, Rosalie. My name is Amanda Jager and I'm also one of the study advisors of this program, and I'm also involved in some of the courses, especially those around academic skills, such as academic writing.
And Leanne, can you introduce yourself?
Yeah, of course. I'm Leanne. I'm currently a second year student of this online master program.
Thank you. And we also would like to get to know you a little bit better. So we'd like to ask you to scan this QR code, which comes in the picture now, or you go to the website of WURtube.com, I believe, and there's also a code mentioned below. So please enter that through your phone or a second website on your computer. Because while you do that, I will explain to you that we'll have this webinar split into three parts. The first part is that we tell you more about the content of the study program. The second part will be about the structure of this master program. And the last part will be about the admission, how to become admitted to our master in Wageningen. Well, I hope you have managed to get into WURtube. So I would like to know where you are coming from. And you can move over this map of the whole world and click where you are coming from. And let's see, I'm very interested to see where you're coming from. Just wait a moment. And yeah, we of course, we are all three here, the Dutch people in this building, because we managed to come to Wageningen. We either live close by to Wageningen, nearby Wageningen, or far away. Leanne lives even in, well, even though the Netherlands isn't that big, for our feeling, it's far away in the north of the Netherlands, or west side north. And I have to admit the majority of our students are coming from the Netherlands, but we also have students from other countries coming. Not sure whether we have some results yet. I think I see some from the Netherlands. Well, maybe some more results. Ah, nice, yeah, also the Netherlands. Yeah, I know it's a bit difficult to click it, so it might also be England or Denmark, for example. Let's see if we have some more people joining us. Oh, this looks like England.
I think it's Scandinavia.
Scandinavia, that's nice. Yeah. Yes, I see it, yeah. Yeah, so Norway, Sweden coming in. Nice to see that, yes. Very welcome to this online webinar. Let's see where our students, our current students are coming from. We'll see that in our next slide. And the ones in orange, those are the countries where our students are coming from currently. So you see we have students coming from Canada, Australia, Hong Kong, but also from South America, like Brazil or Argentina, from South Africa, like Uganda also, and Kenya. We also have some students coming from Asia, though I also have to admit here that some of those students moved to the Netherlands. So we have people from Bangladesh, let me check, Iran and Pakistan. So that makes it really an international setting in our master. We consider this as very unique, and we also see that our students appreciate it very much to have this international setting, because you get to know each other, of course, but also what is the situation in other countries of the world. Let's go to the content of the study program. Amanda, can you tell us more?
Yes, of course, I can tell you more about our program. Well, our program is a master program, and like Rosalie said, it's a very unique program. So this program, it allows you to have a part-time study and also gives you the opportunity to combine study life also with work or family life, all in the context of lifelong learning. So what we usually see is that our population I think the average age is around 40. So we have many people joining who are already graduated a time ago from their bachelor, and they are looking for a new challenge or experience. And that creates a really nice atmosphere there. But within the program, we offer you a 2-year of courses, and these courses, they will prepare you afterwards for a tailor-made internship and an academic thesis. And I will show you later what you can expect of the content in detail. But what is really nice about our program is the flexibility that it has. So you can decide upon yourself if you want to study on certain days, or in the evenings, or in the weekends. So there are no fixed days that you need to study, which makes it more easy to combine it with whatever you want to do next to it. Well, in this master, you will learn how to investigate the link between nutrition and health. And during this master, you will learn how to interpret data, but also how to select the right data analysis tools. So you will work with state-of-the-art methods, and you will learn how to come, for example, to an intervention study or a public health policy. And the overall goal of this master is how can we improve the quality of life of population? So how can we improve general health? Well, our master is called Nutritional Epidemiology and Public Health. And I would like to tell you more what dish, literally, you get when you choose to go for our master.
Yeah. Well, 1 second, Amanda. In between, when you have questions, you can always post them in the chat function, and I will be reading the question, and I will check with Leanne or Amanda to hear what the answers are. So whenever you have a question, just come in between to write it up, and I already saw some questions coming in. I'll come back to those later. Yes, thank you, Amanda.
Great. Well, let's start with explaining our masters by the letters of the word dish. And let's start with the last letter, the H. So this master is all about the health of the population. For example, can we prevent people from developing diabetes? What are the factors that are influencing this? How can we prevent that with nutrition? So one important aspect of this master is the intake of nutrients. So within the master, you will learn how to assess this and what is the effect on the status of the body. What is the effect in healthy people, but also in diseased people? So that is what the S stands for, status of the body. And you will get some courses about nutritional physiology. How does the body work? Well, you can either change the health of the population by adjusting the intake of nutrients, but you can also look at what determines what we eat. So for example, if you would introduce a sugar tax, would that influence our health? So the D stands for Determinants of Health, and it's more than even the industry, it's also the social environment, the culture, all the aspects that are influencing what we consume. Well, within our master, we cover all these different, I would say, the points of view, and they're all integrated with each other. And in the next slide, I want to show you what kind of courses you can expect. So they're listed here. So it's a really broad range. It ranges from epidemiology, which is literally the study in which you look at the distribution of diseases over the population, to physiology, as I just told you, but also public health policies. So what steps do you take in the public health cycle? You also have a course on randomized control trials, statistics, of course, because you also need statistics and data analysis to do proper research. And there are many more courses, also more on cardiovascular diseases, for example, and on communicable diseases. Well, on top of these courses, we also give you academic skills trainings, and we have some project work. And also courses that are combining all the different aspects and integrating all the evidence that you find in these different courses.
Thank you, Amanda, for this introduction about the whole master and the courses. So now we come to the experts, Leanne indeed. Now you are in this master since last 1.5 years. I know that you haven't completed all the courses yet, because that will be at the end of this year. Which was your favorite course?
Yeah, it's kind of hard to choose right now. But if I have to, I would say the Wageningen Week, of course, and epidemiology and public health policies. And that's especially because those are courses in which you have a lot of group work, and it's really great to work together with other students and learn.
That nicely adds up to a question of one of the viewers here, because I told you that it's an international setting, so we have students from all over the world. So how do you collaborate with students from like Canada or Australia? How do you deal with that?
Yeah, actually it's quite easy. I was meeting with a student from Australia, I guess, this morning, and it's pretty easy to just pick a time that it's convenient for both of you. So it's doable.
It's doable, because you're also flexible, I guess. And if you have to do some group assignments, how large are the groups most of the times?
Most of the times, like 3 or 4 students in one group.
That's doable, I would think.
Yeah, of course.
Thank you. Yes, thank you, Lianne. Well, then we have a new question for you in our WURtube lab. So that will come into your screen now. We would like to hear from you what you would like to learn. And you can click more options if you like to. Because that will also help us to see and for yourself also to see whether you're the right address here when you're looking for this master, or whether this is the master to start with. So do tick any objective you have. And in fact, all these options which you can choose from are the learning objectives for our online master. And I see the first answers coming up. That's great to see. Because in the end, it will all come to become an epidemiologist indeed. And also, when you know how to do the epidemiology, you can also implement or evaluate public health programs. The overall objective indeed is to prevent disease and promote health. Don't see any new results coming up, but let me think. So you came to watch this webinar with a certain expectation of the program, and all these learning outcomes are mentioned here. That's great. Now I see some new results coming in. So that could be indeed your personal goal, why you would like to choose this master. I also see to implement and evaluate public health interventions, to learn how to perform clinical research. That's one of the courses also in our master. Do you remember that course, Lianne, the randomized control trial? That was about a year ago.
Yeah, of course. Yeah. It's not in the top of my head, but I remember the name of the course.
That's quite some time ago. Because it hooks up on epidemiology, because there you learn how to perform a control trial.
That's true.
Yeah, thanks. That's great. I think we can go to the next one. Because all these learning outcomes, they always link to the nutritional science, what we are looking at. So Amanda, I would like to continue with you again.
Yes, thank you, Rosalie. Well, what I just told you is quite general. So I showed you the letters of DISH and the different points of view that we have within our master program. But I thought I need something that can illustrate a little bit better what you can do after your master, but also what you can do within your thesis. So I asked one of my colleagues, can you give me an example of the work that you're currently doing? And then she came up with this. So what you see here is a typical Dutch meal. It looks kind of similar to what I had last night, I need to be honest. So many people in the Netherlands, they eat boiled potatoes, and especially the elderly. So for the people that are over 70 years, almost half of them, they eat boiled potatoes more than 4 times a week. Also with a lot of meat. And the researchers, they started thinking about the health effects of potatoes. Since we know that potatoes, they have blood pressuring, lowering nutrients, so it might be beneficial for your heart. But on the other hand, they have a quite high glycemic index, which means they're a source of carbohydrates. So that might also be kind of risky for your health. So that is what they investigated in this research. And I've put a red box over 2 names here. And that's to illustrate two master students of our program that have that also collaborated in this research. So let's go to the research question of this particular research, because that is what research always starts with. So the researcher, they asked the question, what is the association between potato consumption and the risk of cardiovascular and all-cause mortality in a Dutch cohort of myocardial infarction patients? So for this purpose, they used quite a big cohort. They used the alpha-omega cohort, and almost 5,000 participants are gathered within this cohort. And they took quite a lot of dietary data from them, so they had a food frequency list of 303 items, and they followed up on these people for 12 years. And as you see here, also on the slide, they did a survival analysis, which is very easily said. It's just an analysis to see whether an event occurs over time. So they checked within a cohort of people that had a myocardial infarct, whether they would die because of another cardiovascular infarction, or whether they would die to all causes. That's what they call all-cause mortality. And they used RStudio to do the data analysis, and this is a freely available software that you will also start working with within our master. So here's a part of the script that they used. So on the first side, it might be very complicated to see what is listed here, but I can assure you, as soon as you start working with that, you will see the logic. So you will learn how to use this kind of software. And I'm also want to show you some of the data, what it exactly looks like. So in the left column with the red circle, you can see the number of participants. So we don't use names anymore. If we use data sets, we all give them a number, so the data is anonymous. In the third column, it's with the blue circle, you can see whether someone has died from a myocardial infarct. Well, in this case, everyone has a 0, which means that they didn't die because of that. Well, we have a lot of data gathered within this alpha-omega cohort, so we know a lot about what is the intake of potatoes, for example. But another example is what you see with the green circle, is the BMI. So we can look at different links to find association between the dietary pattern and the prevalence of certain diseases or incidences. So you might be wondering, well, what came out of this research? And this is what I've depicted here. So here you see two different ways that we generally use to display results. So on the left side, you have some graphs, and the same is also presented on the right side in the table. So let me take you through the results here. So if we go to the left top, we see cardiovascular mortality. So what the researchers did here is they looked on the horizontal axis at the consumption of potatoes in grams per day. And on the vertical axis, they calculated the chances of dying due to cardiovascular diseases. And you can see that this thick black line is quite flat. So they didn't find an association between cardiovascular disease mortality and the consumption of potatoes. Well, if we go to graph B, it says all-cause mortality, then we see that this line is slightly going up. Well, it isn't significantly, statistically significant. There is a trend that there might be an association between the consumption of potatoes per day and the risk of just dying in general. And that's also what you see in the table on the right side. If you don't directly see it, you just have to believe me. But what they did here is they split the group in 3 tertiles, also based on how much potatoes they consume. And the more potatoes you consume, the less person years you have left. So what did the research concluded from this? Well, researchers never directly jump to conclusions. If you read a scientific article, you will see that they always start with discussing the results. So some questions that these researchers may ask is, how do our results compare with other studies? And can we explain it when we see differences there? Can we also explain the observed association, what we find in physiology? That is also the reason why we have the course about nutritional physiology within the master program. So it doesn't stop with the finding of a certain link between potatoes and cardiovascular disease, but you're also going to dive in what is happening in the human body? Can we explain what we see? Another very relevant question is, to which populations can we generalize our results? This was a study in Dutch people, but can we also translate it to the Americans or the people in Africa? And what is different between these groups? A very good one, and I would say that would be a question always to start with before you do your research, is what is the relevance of this research? So why do we do this? Very relevant, and it is always good to stay critical, and that is something that you will also learn within this master. So to get the academic attitude, what are the strengths of my research, but also where are the limitations? What would I do differently next time? Or what would I do differently if I had an unlimited amount of funding, for example? Well, and then we go to the conclusion. So what this research has concluded is that in Dutch post-myocardial infarct patients, potatoes, mainly boiled, are not associated with mortality due to cardiovascular disease, but possibly aversively, that's really carefully said, associated with all-cause mortality. And these findings, they also need confirmation in other cohorts. That's their recommendation. So this would be an example of something you could do possibly after the master or during a master thesis, like 2 of our students already did.
Thank you, Amanda, for this very interesting example. And I noticed there are some critical listeners in this audience, because one of them also asked, did they only look at boiled potatoes or the different preparation? But I understand from the conclusion that they looked at several preparations for the potatoes consumption. And you also mentioned there were some students involved as a master thesis student, so they joined the PhD student in this project. And we also happen to know that this PhD student, for whom it is her research project for a couple of years, like 4 years in the Netherlands it is. And she also did her master in Wageningen, also in epidemiology and public health. So that's what we often see, is that our students, first they do their bachelor, of course, then the master, and from there, some of them, or a majority of them, they continue in research, and then another majority of them continues as a PhD student, PhD fellow, to in the end also get a PhD degree to become a doctor in science. So that's definitely possible in our master. Yeah. Now we've seen some master students helping, also doing their own research questions within this project, and through the courses we hope that they get some hands-on to finally do that during the master thesis. So now the question for you is, Liana, now you are 1 year, 1.5 year in this master. Do you feel that you getting the techniques in hand or at hand, that one day after half a year you're ready to start your own master thesis and do your own research?
Yeah, I think I do. Of course, it's always a little bit scary because it's like driving. You have to do it first, and when you're getting your license, you think, I'm great. And when you have your first miles at your own, it's a little bit different. So I think that will be the case for working after this master too. Yeah. But yeah, I think I'm ready to start after this master.
Nice.
Yeah.
Yeah, and also during your thesis, of course.
Yeah, of course. Yeah.
Because indeed, what you say, you first learn the theory, but through the courses you also get some practical assignments, and you get to do it yourself. And that will make you feel confident to also do the thesis one day.
Yeah, there's a lot of group work in which you really are going to learn how to apply it in real life.
Yeah, in real life, that's what it is. Yeah. Well, now we have this nice example of potato consumption and the risk of cardiovascular disease. And Amanda, you're going to tell a bit more about the features of the structure of the program. How does it look like, and what does it mean when you do an online master study?
Well, it will also be about the features. That's the title of this slide, of this online master. So this online master is recognized as an international accredited program, which means that after completion, you earn a full master degree which is equivalent to if you would do a master here at Wageningen University physically. So it's a real good master program. Well, the nice thing about this master is that you can take it on a part-time basis. So instead of taking a master, which would be 2 years full-time, you can divide it over 3 or 4 years, whatever fits to your schedule and your situation the best. So you're expected to schedule like 24 to 20 hours a week for studying, and it really depends on your background. Some people, they have courses that will take them less hours. Other people, they have other courses that are more challenging, and then you need to spend some more time on it. So what we see is that many of our students, they have a part-time job next to the study, or they take care of the family or of the parents. There's of course a lot possible because you are boss of your own agenda. You can schedule it whenever you want and also study wherever you want. So like we showed in the beginning on the world map, we have people joining from all over the world and also in different time zones. So that's why it's really nice that you can choose for yourself, when do I want to do one of the e-modules, for example. And also what is nice is that I know that some of our teachers, they also organize live sessions. And sometimes they do it at 2 times a day, like really early in the morning and also in the evening, to make sure that everyone can join in the appropriate time zone. Well, let's see what the schedule looks. Oh.
Yeah, we have a WURtube.
We have a WURtube question in between.
We have a question for you again. And yes, like Amanda said, you can do your master study next to your family life or next to your job. So we would like to also hear from you, what is your current situation? In what kind of situation are you? Are you going to thinking of doing the master after your bachelor or next to your job? Whether maybe also next to another master program, or because you also want to spend your time next to taking care of your family. So let's see, and these are all the situations what we regularly see in our student population. Because, well, we have a large range in age. So we have the young students like Leanne, so ranging from 23 up to 65 or even a little bit older years old. And I think the average age of our students is between 40 and 45, I guess. It's kind of an average. So that's what we really see, that students, most of the students do their master next to their job. And I have to say that it's not meant to do your master studies next to a full-time job, though we really know some students who manage to do it, but it's not something what we would recommend. So whenever you're thinking of this master and you continue working next to it, then do consider to do it in a part-time way, like 3 to 4 days a week, because I definitely think that you also need some time for social life. Yes, we see that most of the people who are watching here today is that they are thinking of doing it next to their job. So do take our advice in, I would say. Let me check. Do we want to ask something more? No. Yeah, so on our campus, we really see that students continue directly from the bachelor to the master, and in our online population, it's way more diverse, well spread, I would say. So yeah, and I need to check one question here. Let me think which I wanted to ask. Yeah, there are some questions about the number of years in this master, and I know that on the website we clearly mentioned 3 to 4 years. We come to that later, but that depends also on how you want to do your master thesis after completing all your courses and also your internship, whether you would do that on a part-time basis, you continue on a part-time basis, or whether you move more on a full-time basis. So that's a short answer for now, but we come to that later also. But yeah, how does it look like when you're going to start with this master? Everything is online and you have to follow courses, but how does it really look like? I'm curious to hear, Amanda.
Well, to illustrate that, let's see, go to the next one. And our apologies for the enlarged view that you have of the WURtube questions. It was good before we started, but I hope that you're still able to see the results when they pop up. We thought it's a very nice way to have a direct interaction with you at home. So, like I said, I just want to show you what the schedule of the first year looks like. And here you see it. So in the first year, we start in August with the onboarding. That is not a complete month. That is a particular week where we have a couple of meetings where you get to know the online platform, you get to know your fellow students, and you get to know us, the study advisors, and also in a really fun way. So we will make sure that you know the platform and you have everything that you need to get started with the courses. As you can see here, you always follow one course at a time. And each of these courses, they take 4 weeks in which you usually have new content in the first 3 weeks. And then you have a couple of days off and always the exam on the Thursday in the 4th week. Well, if you pass the exam, then of course you can continue with the next course. And the nice thing is that all the knowledge that you get in one course, it will be built up on in the next courses. So what kind of material you get within the courses, it really differs from one course to another. So some courses have more e-modules, other ones have group assignments or more individual assignments, like report writing with public health intervention, for example. So it's really diverse, and you can check the study handbook for all the different courses and what you can expect from these courses. And also it's very nice to read what you will learn eventually. So also the learning outcomes are described there. And I think the link to the study handbook has already been shared with you. Well, next to the courses, we also have skills trainings, and you see one big block in December. There we will focus on information literacy and also scientific writing. But also in the second year, we'll have focus on argumentation skills, presentation skills. So you will get a good training in these academic skills, and we hope that we can work on your academic attitude as well. Well, you have two options a year to do research. One we have in February, and the other one is in the summer holiday. And if you have no research, then you just have holidays. So there are many options to retake an exam if you haven't passed the first one. But just to show you that after the first 2 years in which you have all the courses, then you are prepared to take all the knowledge and the tools that you have learned into practice. So you always start with your master thesis, which is an individual research project that you will perform under the supervision of a WURtube supervisor. So then you will virtually be working at the Wageningen University. And here you see one of the nice buildings where actually Rosalie and I are working, and many other nutritional researchers. And usually you will get a data set that you will work on. So you can do it just from home. If you live abroad, it is also possible to do a thesis here at the Wageningen University. But sometimes we see that people who live close by Wageningen, they come for the thesis also physically to Wageningen. So that would also be an option. Well, I've said there it's 6 months, the master thesis, and that's on a full-time basis. So we have some students who took the courses on a part-time basis, so they spent 2 years on taking the courses, and then they switch to full-time. And then they're done in 6 months. If you would do it completely on a part-time basis, it can take longer. So it can take like a year to complete the thesis, which is very usual. Well, after the thesis, you can continue with the academic internship, and that gives you even more options to go to. So you can go to other research institutes or health organizations or companies to do an academic internship. But this is a project that is a little bit shorter. So it's for 4 months on a full-time basis. And, 8 months or something like that. You can just decide it for yourself. And if you do it on a part-time basis, you can do it abroad, you can do it here in the Netherlands, or you can do it in the country where you're currently living. So there's many possible there. And when you will visit us here in Wageningen in the WUR week that Lianne already mentioned, then we'll also tell you more about the different options that you have for your thesis and your internship. It will also help you to find a nice match with our teachers. Well, to summarize our program shortly, so in the first 2 years you will take all the courses on a part-time basis, and all the different topics that are described in DISH. They will be taught to you. So we have talked about the determinants of health, the intake of nutrients and how to assess this, the status of the body, and how to improve the health of the population. Well, after these courses, you will do your thesis, which is 6 months on a full-time basis. Then you continue with your master internship, 4 months on a full-time basis. And then in total, it can take you like 3 to 4 years that it will take you to finish off this master program. It really depends on if you study completely part-time, then it will take you more than like 4 years. And if you choose to do your thesis and your internship full-time, then you can be done in 3 years. That's really up to you.
Yeah. Thank you, Amanda, for this complete overview. And I know there are some questions, and I also remember from a previous session, the students always wonder, how does it go when you follow a course? Do I need to be there online 9 o'clock on Monday morning? Or what does that mean when you follow a course? You need to follow 16 courses in a period of 4 weeks every time, and you need to conclude it with an exam. So Liana, help us out. How does it look like when you follow a course?
Well, a course always starts on Monday, and then the first 3 weeks are just a lot of knowledge that you get that can be done by video clips or group assignments or reading some books or stuff. And in the 4th week, you have an exam. That will
you have to come to Wageningen then?
No, of course not. No, would be fun, but no. The exam will be at home. Then you have to do a quick room scan to let your teachers see that there's nothing in the room that you can cheat with. And you have a whole day to make your exam.
So you make a room scan, but afterwards, do they follow whatever you write, or do they also record?
Yeah, everything. They can see everything. So they can see your screen, but they also can see what you're doing and your camera, and so they can see you.
Yeah, in fact, they just record the whole computer and also yourself. So you cannot have another screen open where you have all the answers or the book open.
No, definitely not. I didn't try yet, but no,
it's not
I don't think so.
To cheat.
No, it's just like you were in a exam room.
That's to make sure that the quality remains good also. And you mentioned about these clips. These are the short knowledge clips. So you don't need to listen to a lecture for an hour or so.
No. I think it's maximum for like 15 minutes, but most clips are between 5 and 10 minutes.
So that's really short, but a lot of information is there. And you can rewind it every time when you don't understand it. You can listen it again. You've done that often.
I really done that often. Maybe most clips are like 3 to 4 or 5 minutes, and then it's not like you just listen to it and then it's done. So you pause it often and you write something about it.
You need to understand it. You need to digest it. Is it difficult, all these courses and these skills training? Do you find it a difficult master?
Yes and no. I think when I just started, I was thinking it would be easier, but it's not. You really have to commit to this master. The first period was also a little bit lonely, but after like a few weeks, we had a groups app with other students, and then you can ask questions more. So then it's more like you are at school, but then home.
And where do you ask questions? Do you do that on your phone, on WhatsApp? You do?
Yeah, we do. We do on WhatsApp with fellow students, but also on Brightspace.
Brightspace?
Yeah, that's the online working
educational environment, right?
And then you can ask your teachers or other students.
So each course has indeed, it's called Brightspace, where all the information is mentioned, where all the links to the knowledge clips are, where the assignments are given, and also the discussion fora, we call it, where you can discuss, and the teacher monitors it, in fact. So when the discussion goes out of hand or completely in the wrong direction, then the teacher comes in and helps you to go into the right direction.
Yeah, there are a lot of places to discuss questions or just the topics you're learning about.
Yeah. Thank you. Let me see. Most of those questions have been answered now. Let me see. Oh yeah, then I think we can go to the thesis and internship. Amanda, you told us about that. And you've told that when you do your master thesis, then you get most of the time a data set, so you can do that online. But what about the internship? You mentioned that you have to go outside the university. Of course, that was online already. But then you go to an organization or company, but do they want you to come over to that company, or is it still... would that be possible to do it online, or you have to do the internship physically?
Well, both is possible. And I think what we've learned over the couple of years is that there's a lot more possible online. So there are more and more options that have been developed over the last years. So also if you are in another country, you can still work together online. But of course, it would also be nice to see if you can go somewhere physically. And what we often see is that people who do their internship somewhere, they would stay with the internship provider. So if you would be looking for a new job, that might also be just an entrance to an employer.
Thank you, Amanda. I think we can go to the next slide. Oh yeah. Yes, still one more question for you, Leanne. And I think you already answered it in between a couple of times, but what did you really like the most about this whole master program so far?
I think I like the most that it's like you're at school on campus. There's a lot of interaction with fellow students, with course moderators, with teachers, but it's at home, so it's easier to combine with a job or other things you have to do in life, and it's easier for people like me. I live like 2 hours away from Wageningen. To follow this master, even though you're not here, but it's really like you're here, only online.
Nice. And I also remember from previous conversation we had that you were a bit hesitant. Oh, you have to do assignments together. I prefer to do it on my own. and
I remember
completely.
Yeah, I remember. I told you that. I remember the first few weeks. I was really scared to meet with my fellow students and to talking in English. But like. After the first couple of times, that all goes away, and then it's great to work together with other people, different age groups, different countries, different cultures. It makes it really interactive, and it's great to do.
And this whole online master is everything is online, and we often get the question also, don't you ever come to Wageningen? But there's one exception indeed. That's the Wageningen Week. You mentioned it. And well, you want to tell something more about the Wageningen
Week? Of course.
Week?
Also something I was really scared about in the beginning, but it's the greatest week ever, because for us it was still online because of COVID, but we had whole days of courses and short meetings with our group and teachers, and it was about a project we did, but also the skills like Amanda mentioned before, the presentation skills and the argumentation skills, and it's like you're together for a whole week, and you learn stuff about the thesis and the internship, so you are quite looking forward to. It's really great to do that.
So finally, after following all these knowledge watch clips, and to reading the theoretical material, doing your assignments on your own or in groups.
It all comes together.
And you meet everybody, and also the professors and the teachers involved. Yeah, nice. Yeah. Thank you. So that was indeed the work week, and that comes in the second week of your master, around, what was it? Beginning of March. I had to think for a moment. So yeah, we also find it exciting because we are there all the time. And then we finally meet you, and often we have seen each other online one-on-one, but to meet the whole group together, that gives such a nice energy. And next year we'll definitely have it on campus again. We show you the whole campus, but also the other companies which are surrounded or which are on the campus as well. On these pictures you see Unilever building, who moved from Rotterdam of Vlaardingen to Wageningen, to the food valley, we call it in the Netherlands. So that's really nice that companies and university are nearby each other. In between, I think so far we have answered all of your questions, but whenever you have more questions, please do post them in the chat function. I will see them. Meanwhile, Amanda will continue to tell us more about the admission. We are a bit relatively small program because we cannot admit everybody, even though so many interested people wanting to start with this master, but we can't accept everybody. So what are the admission criteria?
Well, let's start with first asking about your educational background. So in BookLab, you can just write, what is your bachelor background?
Yes.
And if it works correctly, we see everyone's background popping up here.
Yeah.
So let's take a couple of seconds for that.
Yeah, maybe in between we can ask, what was your background? Which bachelor did you do before you came to Wageningen?
I did nutrition and dietetics in Amsterdam before, and I worked for a few years, and then
as a dietitian.
Yeah, as a dietitian, and then I wanted more, so I came to Wageningen.
Yeah, nice. That's what I think quite a lot of fellow students did nutrition and dietetics, either in the Netherlands or elsewhere. We also have students from the biomedical sciences, or for, how do you call that, geneeskunde, medicines. They often do that as a second master, next to their first master, of course, medicine. What else? Health sciences. Quite some bachelors do fit to our program. And I see the first coming in, a bachelor in environmental sciences, I guess. Yes, nutrition dietetics also. Yeah, dietetics, nice. Yeah, so you're at the right place, I would say. That's my first opinion here. Bioengineering I also see. Yeah. So it's a typical answers what we often see in our master as well. So let's check with you, Amanda, whether this is physical therapy, PT, and movement sciences. Let me think. I know we have them on campus. Yeah. I'm not sure whether we have them in our online master, but we do definitely have similar backgrounds. Okay, let's go to the real admission criteria, the requirements, Amanda.
Yeah, let's tell you a little bit more about that. So you can be admitted to the program if you have a relevant bachelor degree. So we've listed a couple of bachelor degrees here. So you see nutrition and dietetics is there. But also if you have another master that has a relationship to health sciences and has a research focus, you can always give it a try and just apply for the master. Then the admission committee, they will look at your CV and say whether you will be accepted or not. But also if you have relevant work experience, that can really help to become admitted to the program. So if you're in doubt, just apply, I would say. Well, you need an average grade of at least a 7, which is the equivalent to a GPA of 70+%. And you need to prove that you're proficient in English. So please check out our website, what tests you can do to prove this proficiency. It's all listed there, and there are many options there. If you want to apply for the program, you can do that via study link. And we've listed the link here. And please do so before the 15th of June this year. Or if you want to apply next year, it's of course for next year. Also, if you haven't received your bachelor degree yet. So if you expect to be graduated before the 1st of September, then also please apply before this deadline and you can upload your diploma later on. But you need to be registered before this deadline. Well, I think that is it about admission.
Yeah. There are some more questions which I would like to address now, coming in from you. First one is about admission. What if you don't have the educational background, but you do think that you already have relevant work experience? Then I would definitely recommend you to apply for the master. If both are not fitting, then it becomes difficult. But if you have some relevant work experience or you follow some extra courses after your bachelor, then it makes it worthwhile to apply for our master. Well, there's a question about how many students are admitted every year, but that's a lot. But not everybody decides to continue with this, to start with this master. That depends on various of reasons. Maybe the tuition fee is one of them, or the personal life. Well, there were a few questions about internships, so I would like to address those, elaborate a bit more on that. So you can do your internship online, and after completion of your internship, then you graduated and you completed your master. But would it be possible, if I'm working at a company already and I've done my thesis at the university, would it be possible to do my internship in my own organization?
That's a really good question. And that is an option, but you only need to check whether the internship is on an academic level and there's a research question to be answered. And of course, it should have a link with nutrition and epidemiology or public health, one of these. But then it is possible, and it happens quite often. Yeah. And if I can also answer the question that we got before, or in a different way, because there are a lot of people that apply for this master, but eventually every year we have about 25 to 30 students who join the master. So it's a really nice, quite small selective group. And I think, Leanne, in your group, I think everyone is also joined in the WhatsApp group, or not?
Yeah.
Everyone knows each other, and they share a lot with each other.
Yeah, that's true.
Yes, thank you. Is it possible to give one example of an internship? I'm thinking, for example, that you could do your academic internship at the hospital. The academic hospital, for example, there are always some questions. How can we, for example, this is an interesting research area, is that you want to limit the number of days that people are hospitalized or the number of days after operation. And then the nutritional status is always important. If you have that on a higher level, you could limit the number of days in the hospital. So there's a lot of research going on about this one. And maybe one of you has another example of an internship, which you can just come up with.
Yeah, I'm thinking about the other internships in the hospital, the ones more linked to colon cancer, for example.
Yes. Thank you.
So there is quite some research that our researchers here at Wageningen do to look at the dietary pattern of people who had colon cancer. So what you would expect is that these people, they would change their dietary patterns in order to prevent becoming sick again. But apparently that isn't the case. And we also have some researchers that are working on the ICU department here in the hospital in Ede. It's really close by. And also in Arnhem, we have a hospital that we collaborate with. And there, for example, we do research at bariatric surgeries.
Yeah.
And we also investigate, for example, women that want to become pregnant and that had such a surgery. How can we make sure that they get the right nutrients and what is necessary for them?
Yeah. So in fact, when you do an internship, it looks very much like a master thesis, what you've done at university, but now you do it at the other location. So it's really an academic internship. I think Yeah, the one question is about, can you combine a thesis and internship? We really prefer you to do it separately. So first a thesis and then a different topic in a different organization for your internship. I would like to go to the next slide because I know we're nearing the end of this webinar, and I would like to summarize what Amanda and Leanna have taught you about. Well, we have informed you about all the typical courses in this online master in the left corner of the slide, and all the courses are structured around the DISH model, Determinants, Intake, Status and Health. And once you know how to assess the epidemiological association between the determinants, intake, status and health, then we are able to play or make an impact on public health. So the emphasis in our master is that we teach you how to perform epidemiology and how to improve public health. So it's not only about the theory, but also about the hands-on how to do your data analysis and epidemiological data analysis, of course, but also how to construct a public health intervention program. Somewhere in the middle, you see this nice diploma. We are accredited program, so the diploma is exactly the same as the diploma which our students from our own campus master get. It's based on a part-time schedule, of course, so that gives you a certain flexibility, but especially in the first 2 years, we have these courses which are taking place every 4 weeks, and we conclude them with an exam. After completion of the courses in those first 2 years, then you have your master thesis and the internship. And there again, there's a flexibility to either continue on a part-time basis so that you finish everything in about 2 years, or to shorten your master period into 3 years, a total of 3 years. That was about everything what we would like to tell you. Whenever you have some more questions, then do contact us. You can find all the information given on the website from our university. But of course, you can also email us by sending an email to bvg.mnh@wurt.nl. So feel free to contact us by email for more questions or for some more information. So thank you very much, Leanne first, for coming all over from the north of the Netherlands to Wageningen. And you'll be going back tonight.
Mm-hmm.
Tomorrow you will work again.
Of course, yeah.
Yeah, and study again. Mm-hmm. Yes, thank you, Amanda, for explaining us everything so well. And thank you for your attention, and hope to see you in the near future.